Hello everyone, I'm Chrislyn Badi, and today me and my partner, Ate Jerlyn, we're gonna perform you the assessment of musculoskeletal system. So before doing the assessment, we need to make sure that all the equipments needed should be disinfected and prepared. And then before you enter the room of the patient, you need to wash your hand and knock the door 3 times. And to provide privacy of the patient, you need to close the door before you enter the room and cover the possible curtains inside the room. Then after is introduce yourself and verify the name of the patient. The best way to verify is to let the patient say their name and check their name bands. And then after is explain the procedure and take the vital signs of the patient. Close the door and then, hi ma'am, good morning. I'm Chrislyn Badi. I'm your nurse for today. So, how are you today ma'am?
I'm good.
Okay. So, can you please tell me your name?
I'm Jerlyn Ladero.
Okay, thank you. So, ma'am, today we're going to assess you your musculoskeletal system, and I really need your 100% participation. Is that okay for you, ma'am?
Okay.
Thank you. And to start, I'm gonna take all your vital signs like your blood pressure, your pulse rate, your respiration, and body temperature.
Okay.
Thank you po. Okay, so to start, put the patient in a sitting position and start by inspecting any abnormal redness, swelling, and any masses in the skin of the patient. And then after inspecting, proceed to palpate the temporomandibular of the patient and instruct the patient to open her mouth and chin out, chin in, and side to side. Okay, so in palpating the temporomandibular of the patient, we're looking for any abnormal clicking or crepitus, or ask the patient if she feel any pain while moving her mouth. Do you feel any pain, ma'am, while moving her mouth? Do you feel any abnormal clicking or crepitus?
No.
Okay, thank you. Next is we're gonna assess the spine of the patient, and I'm gonna instruct the patient to stand. Stand, ma'am, and turn around. Okay, thank you. And then I'm gonna instruct the patient to bow her head, bow her chin to her chest. Okay, and then I'm gonna start palpating her spinous processes on her neck all the way to C7, and I can feel that this is all straight. And after palpating the spinous processes of the neck of the patient, I'm gonna instruct the patient to sit again. So we're gonna check her, and we're gonna check her range of motion. Okay, thank you. So to perform the range of motion of the neck of the patient, instruct the patient to look up at the ceiling. Look up at the ceiling, ma'am. Put your chin in your chest. Okay, and look side by side. Okay, and put your ears on your shoulder, each side. Okay, and then to test the strength of, to check the strength of the patient, I'm gonna put my hand on the face of the patient and instruct her to against it. Okay, ma'am? Against. Okay, the other side. Okay, so thank you. Okay, let's proceed to assessment of the shoulder of the patient. First is instruct the patient to stand, to, here ma'am, and then to stand to perform the range of motion of her shoulder. Okay ma'am, so I'm gonna instruct the patient to side by side. This ma'am, side by side. Lift your hand all the way back to your head. Okay, and then um, back down, and then next is another is swing all the way up and swing all the way down, and then behind your back. Okay, thank you. Good. And then instruct the patient to shoulder shrug. Shoulder shrug, ma'am. Okay. Again, one more. Okay. And then start palpating in your shoulder. Do you feel any pain, ma'am?
No.
Okay. And look for any abnormalities or any tenderness. Move down to elbow. And then look for any abnormalities. And as I can see any abnormalities in her shoulder and in her elbow. Okay, to test the range of motion of the elbow of the patient, instruct the patient to bend up the elbows. Okay, then put them down back straight, and then hold like this, and turn over again. Okay, very good. Next is I'm gonna check the strength of the elbow of the patient by instructing the patient to pull herself against on mine in her elbow. Okay, ma'am. So bend your elbow, and I need you to pull yourself against me. Okay. Okay, very good. And the other side. Okay, very good. Thank you. So they're in the range of motion and strength of the patient on her elbow is normal. Next is to assess the range of motion of the wrist and the hand of the patient. First is instruct the patient to put her wrist down. Okay, and put your wrist up. Okay, then spread all your fingers and put them back together, and then put only your fingers down, yan, and straight again, and turn over. And then after turn over, I'm gonna check the strength of the patient's finger. Okay. Okay, very good. Thank you. So next is I'm gonna palpate the wrist and the hands of the patient. Okay. In palpating, we're looking for any enlargements, and ask the patient if she feel any pain while you're palpating in her wrist and in her hand. We should do this palpation in both hands. Do you feel any pain, ma'am?
No.
Okay, thank you. Okay, so next is we're gonna assess the hips of the patient. So first is instruct the patient to lay back, ma'am. Okay, thank you. And then start palpating the hips of the patient. Okay. And ask the patient if she feel any pain or if she has any problem on her hips. Do you feel any pain, ma'am?
No.
Okay. Do you have any problem in your hips?
No.
Okay, thank you. So after palpating the hips of the patient, let's proceed to test the range of motion of the leg of the patient. First is to instruct the patient to move out her one leg, okay, and move back in. Next is to lift it up and put it back down. And then next is to bend as long as she can, and then come in, come out, and put it back. And then to check the strength of the leg of the patient, I'm going to instruct the patient to move her leg out against my hand, and then move her leg in against my hand. Okay? And then do the same process on the other leg by instructing the patient to move out her one leg and move back in, okay, and lift it up and put it down, then bend as long as she can, and then coming in and come out, and then put it back in. And again, to check the strength of the leg of the patient, instruct the patient to move out her leg against my hand, and to move in her legs against my hand. Okay, ma'am, very good. Thank you. Okay, so for now, I'm just gonna skip the knee for right now, and I'm just gonna move down to assess the feet, the ankles, and the toes of the patient because it's already exposed here. So assessing the feet, ankles, and toes of the patient. I'm gonna start by palpating on it. There's a lot of bones here need to palpate, and make sure that you palpate them all, from feet to your ankles and to toes. Okay, and then proceed to the other feet and do the same process in palpating. And make sure that you palpate all the bones in here. Okay, then after palpating, check the strength of the feet of the patient by instructing the patient to push her feet against my hand. Okay, very good. And pull her feet against my hand. Okay, very good, ma'am. Thank you. And then next is instruct the patient to bring her toes together and bring it out. Okay. Then put it back in and bring it in. Okay, like this. And bring it out. Okay, very good. Thank you, ma'am. Okay, so now I'm gonna move back to assess the knee of the patient. To start assessing the knee of the patient, I'm gonna start it by palpating it. Okay, palpating, and ask the patient if she feel any pain while I'm palpating her knees. Do the same process on the other knees, and ask the patient if she feel any pain on her knee on her knees while she's walking or running. Ma'am, do you feel any pain while I'm palpating your knees?
No.
Okay. And do you feel any pain while you're walking or running on your knees?
No.
Okay. Thank you. So after palpating, we're gonna proceed to test the range of motion of the knees of the patient by instructing the patient to push her leg against my hand. Okay, okay. Okay, very good. And then pull her legs against my hand. Okay, very good. And do the same process on other side, other leg. Okay, ma'am, push your leg. Okay. And pull your legs against my hand. Okay, very good. Okay, then instruct the patient to stand. Stand, ma'am, please. And then instruct her to put her leg out straight, like this, ma'am. And then bend her knee. Bend her knee. And put it back. And do the same with the other side. Put your leg out straight. Okay. And bend knee. And put it down. Oh, very good. Thank you, ma'am. So, to start assessing the spine of the patient, instruct the patient to turn around. Okay, turn around, ma'am. And then, I'm gonna inspect the symmetry of the shoulder of the patient, the scapula of the patient, and the hips of the patient. And then, I'm gonna start palpating in her, can you bow a little, ma'am? Okay. I'm gonna start palpating in her spinous processes all the way down to check if there's any tenderness found. And then, after palpating the spinous processes, I'm gonna instruct the patient to bend on her, to touch her hand on her feet, to bend on her feet. Okay, and then check the symmetry of the shoulder and the scapula, and as you can see, the C curve in her spine. Okay, ma'am, thank you. Okay, and then instruct the patient to stand back up and look up the side of the spine of the patient. The thoracic spine should be in a convex curvature, and the lumbar spine should be in a concave curvature. Okay, ma'am. And then let's proceed to check the range of motion of the spine of the patient while instructing the patient to put her both hands in her hips. And then here, ma'am. Okay, and then bend each side. Okay, and the other side. And then move each side while you're not moving your hips. You can hold your hips, okay? Move each side. Okay, the other side. Okay, ma'am, thank you. So our assessment is done, and we're done checking your muscle and joints, and everything is normal and everything is fine. You're in good shape, and thank you for participating all throughout the assessment. Thank you, ma'am.
Okay, thank you.
So after the assessment, make it sure that you take again the vital signs of the patient, and then keep all the equipments that you've been used in the middle of your assessment. And then don't forget to wash your hands and then disinfect the equipments that you've used. And then last, the most important is don't forget to make a documentation about the assessment that you did. So so I'm done doing my assessment of musculoskeletal system, and thank you and God bless.